Hi, today we will be discussing an MCQ from the topic sedative hypnotic. Okay, it's relatively a small topic, and this question is frequently repeatedly asked in the NEET PG sessions. Like, so this is the clinical case scenario, like a 45-year-old patient that represents with complaints of difficulty initiating sleep, and the physician prescribes a drug that acts selectively on the GABA A receptor and which has minimal effect on the sleep architecture and is associated with lesser risk of dependence. Which of the following drugs is most likely prescribed among these four? Okay, so this is the question. So the catch points is the patient is having to initiating sleep. Okay, initiating sleep, and the drug should act on the GABA A receptor with minimal effect on sleep architecture and lesser risk of dependence. Sleep architecture means less interference on the REM sleep pattern. Okay, so now coming to the drugs which is used as sedative hypnotics, this is the classification. Like benzodiazepines are there, benzodiazepine-like drugs, barbiturates, melatonin receptor agonist, and orexin receptor antagonist. Among benzodiazepine, the short-acting benzodiazepines are used as sedative hypnotics, triazolam and midazolam. Among this, midazolam is not used as sedative hypnotic, but triazolam are nowadays used as sedative hypnotics. And one intermediate benzodiazepine drug, that is alprazolam. Okay, alprazolam. This is also used as sedative hypnotics from the benzodiazepine group. And the second major classification is the benzodiazepine-like drugs. It is also called as non-benzodiazepine drug, or also known as Z drugs, because in this group all drugs are starting with Z: saliplone, solpidem, esopiclone, all those drugs. Okay, benzodiazepine like drugs or non-benzodiazepine or Z drugs, saliplone and solpidem. And the third group is barbiturates. Secobarbital is a short-acting barbiturate, and these are not at all used as a sedative hypnotic nowadays. Okay, and the most commonly used sedative hypnotic among is melatonin receptor agonist. Like, this is specifically should be noted, it is an agonist, like melatonin MT1 and MT2 receptor agonist. And the last classification is orexin receptor antagonist, like suvorexant. Okay, so now coming to the classification, or coming to the mechanism of action of the sedative hypnotic drugs, these three drugs like benzodiazepine, non-benzodiazepine drugs and barbiturates are acting at a specific receptor as mentioned in the question is GABA A. Okay, GABA A receptor, whereas these are acting at the MT1 and MT2, and orexin receptor are acting at the OX receptors. Okay, orexin receptors. So this is the structure of a GABA A receptor, and it is a ionotropic receptor. Okay, just should also be noted, like ionotropic receptor. Why I am specifying ionotropic means there is also another GABA receptor, like GABA B receptor is also there. The drug baclofen is acting. Baclofen. Okay, this GABA B is a metabotropic or G protein coupled receptor, metabotropic receptor. Okay, metabotropic spelling is mistake. Metabotropic receptor. So here coming to the GABA A receptor, this GABA A receptor consists of 5 subunits. Okay, this GABA A chloride channel complex is consisting of 5 subunits, that is alpha 1, alpha 2, beta 1 and beta 2, and a gamma subunit is there. So these 5 subunits constitute the GABA A receptor. And this GABA A receptor, mainly the GABA binding site. GABA is the neurotransmitter. GABA is a inhibitory neurotransmitter. GABA is a inhibitory neurotransmitter, and this GABA is binding in the interface, in the subunit interface of alpha and beta interface, whereas the benzodiazepine is binding to the alpha gamma interface. Okay, alpha gamma interface, and the two other drugs that we mentioned are the Z drugs or non-benzodiazepine drugs. Z drugs are binding to the alpha 1 subunit alone. They don't bind with the on the interface like alpha beta or alpha gamma. They bind alone with the alpha 1 subunit. Okay, so these alpha subunits are having several subtypes like alpha 1 to 5 subunits are there, and alpha 1 subunits are mainly helping in the sedation and hypnosis. Okay, sedation and hypnosis, and whereas like alpha 2, alpha 3 and alpha 5, all these are dealing with the anti-anxiety effect, anti-anxiety, skeletal muscle relaxation, and anti-convulsant. Okay, anti-convulsant. All these actions are dealt by other subtypes like alpha 2, 3, and 5. Okay, so these Z drugs are only binding with the alpha 1 subtype. That's why these Z drugs are having no effect on anti-anxiety or skeletal muscle relaxation or anti-convulsant action, which are elicited by the benzodiazepines. Okay, so benzodiazepine, if you are giving a benzodiazepine, for example, if you are giving triazolam for the sedative hypnotic purpose to a patient, this triazolam can bind to all these subtypes like alpha 1, alpha 2, alpha 3, alpha 4, alpha 5, all these subtypes it can bind. And they can cause sedation, hypnosis, and they also can cause anti-anxiety or skeletal muscle relaxation, anti-convulsant effect. All these effect can be elicited by this drug, which is an unwanted effect. Okay, so by giving Z drug we can reduce all these unwanted effect. And the last one is a barbiturate. Barbiturate are mainly binding to the beta subunits. Okay, barbiturates are mainly binding to the beta subunits. So these three drugs, benzodiazepine, benzodiazepine-like drugs, and barbiturates are binding at the GABA A receptor. GABA A receptor is an ionotropic receptor which helps in the conductance of chloride ion, and this chloride ion is coming inside to the cell and which causes hyperpolarization. Okay, hyperpolarization. So coming to the next slide, here we can again see the benzodiazepine, barbiturates, and non-benzodiazepines are there. Benzodiazepine is mainly binding at the alpha gamma interface and it is a GABA facilitator. This is also NEET PG question like GABA facilitator. Which among the following is a GABA facilitator? That is, if there is a GABA receptor is sit here, GABA, this is the GABA A receptor, and benzodiazepine is coming, and if there is no GABA, if there is no GABA, that is the neurotransmitter, then benzodiazepine cannot open this channel. Okay, this benzodiazepine can only open this channel in the presence of GABA. Like they facilitate the GABA to bind to this receptor and opens this channel. Alone, they have no action. And by binding benzodiazepine to the GABA A receptor, they increases the frequency of the GABA A channel opening. Okay, GABA A channel opening. Coming to the barbiturates, these are binding to the beta subunits as we already mentioned, and these are having GABA mimetic action, and they increases the duration of the GABA A channel opening duration of the GABA A channel. Here it mentioned as GABA mimetic. Why means because this GABA alone, this barbiturate alone can act like a GABA neurotransmitter. That is, alone they can open the GABA A receptor and helps in increasing the conductance of the chloride ion. Whereas non-benzodiazepine, these are binding to the alpha 1 subunits which causes sedation and hypnosis other than alpha 2, alpha 3, alpha 4 and alpha 5. All these are dealing with anxiety, skeletal muscle relaxation and anti-convulsant action. All actions are there dealt by other alpha subtypes. So these non-benzodiazepines are devoid of all these actions, and these are having minimal effect on the REM sleep with less tolerance, dependence and abuse liability, they lack anxiolytic, muscle relaxant, and anticonvulsant action, as we mentioned here, because they don't have action on other alpha subtypes. And flumazenil is a what we say, it's a competitive antagonist, and these are used in the toxicity, to prevent the toxicity of benzodiazepine and non-benzodiazepine drugs. Okay, this can be used in both conditions, benzodiazepine and non-benzodiazepine. This is a competitive antagonist. Okay, so please note the difference, like GABA facilitator, GABA mimetic, and this alpha 1 subunit action having minimum REM sleep, which is asked in the question, like the drug which acts on the GABA A receptor with less sleep distortion and less dependence. Okay, so the answer is non-benzodiazepine. Among the option, there is a non-benzodiazepine option is there. Okay, now coming to other drugs which used as sedative hypnotics nowadays is this melatonin agonist, ramelton, are frequently used, like 8 milligram once daily used. And other than that, ramelton or melatonin agonist, civorexant, which is a orexin receptor antagonist, they help in reducing the wakefulness. And another one is a lemborexant, which is also having similar like action, like they also block the orexin receptors and they promote sleep. And the other two drugs, ritanserin, they block the 5-HT2A2C receptor and they increases the slow wave sleep. And the last option is agomelatin. Okay, it's having dual action, like it's having agonist action at MT1, MT2, and antagonist action at 5-HT2C receptors. And this also helps in circadian resynchronization. Okay, so all these drugs are used as sedative hypnotics, along with one more drug, that is doxepin, which inhibit the H1 receptor and induces the sleep or sedation. Doxepin. Okay, so I hope this session was helpful to crack this sedative hypnotic, and we'll see you in the next video. Okay, so till then, take care.